Welcome back. The coronavirus pandemic continues to cause havoc across the globe. In India, thousands are dying daily, with the country recording daily new infections of over 340,000. India has become the new COVID-19 hotspot with nearly 17 million confirmed cases. Let's get an update now with former senior editor at the Tribune Media, Prasad Kunduri. A very good afternoon to you, Prasad, and thank you so much for your time. So, of course, many might be thinking that the case is so out of control, but then you put it into perspective to say there are 1 billion people in India, so therefore 340,000 cases, although sounds quite large, is somewhat in perspective of the population, somewhat normal?
Well, good afternoon. Well, let us take it this way. Statistics have a different dimension. In terms of population, the percentages may certainly look different. But a person is a person, of course, a human being. The human life is most precious. So every government, everybody is very conscious of the fact that a loss of life or harm to a loss or life itself is something which is deeply disturbing. Having said that, yes, in terms of the numbers of people, we are very, very large. There are 130 plus billion people. So the number of cases, if you see in terms of percentage, as you mentioned, may look different. But one of the primary focus of the government, both in the center and the state, is to ensure that the spread of the virus does not enter the villages in the rural sector, because that's where the issue is very careful, or has to be very careful, because when cities are under strain in terms of the hospitals and in terms of medical care facilities, obviously as you go down, the numbers do come down and it adds to the burden. So one of the primary focuses is to ensure that the spread is not there. What we are reading figures is from large towns, and in fact the numbers that are showing up, some of the big 5 states, including 4 in the south of India, 1 in the west, that is Maharashtra, and of course 1 in the north in Uttar Pradesh. These are the big states where the numbers are coming up in higher degrees. So this is where we stand this afternoon.
The numbers are looking at about 130 million inoculations that have been administered so far. Is that a good rate, given, and I ask this question as in terms of how the inoculations are supposed to be happening. Is it happening at a satisfactory rate, or should it be at a higher number at this moment?
Well, the scientific community and the doctors are recommending at a higher rate of inoculation. And as we speak, from the 1st of May, the government has relaxed and liberalized the vaccination schedule. Anybody over the age of 18 will now be entitled for a vaccination. Of course, there is a system which has already been kicked in from January 16th, wherein you go and register, citizen registers on a portal called COVID, which I mentioned on your eNCA much before, very many months ago. So that's the process, and then you get yourself a slot and walk into the place. Of course, some hospitals were taking walk-in in the phase 2 and phase 3 when they opened up for people over the age of 45. But now that will change. Meanwhile, the government has asked the manufacturers of the medicine and the vaccine to ramp up production. They have released additional grants for them to ramp up the production, and also looking at other sources where I think there are a couple of more vaccines which are in the process, which could add to augment the facilities of vaccination. Surely, in terms of, again, if you look at the reverse numbers in terms of population versus the number of people inoculated, yes, the numbers don't look very big. But let us also look at it. Phase 1 was health workers, the frontline workers. The phase 2, they opened up for people between ages of 45 and 60. People above the age of 60, people like me were allowed. Then came the 45 and 60 category with certain medical conditions, and then to 45 and above without conditions. So phasing out with the availability of vaccine and working on the logistics, because all of us know the cold chain facilities have to be available in a widespread in this country as big as we are.
Prasad, there's talk of the United States assisting India with the situation in that country, of course, with their COVID-19 situation. Can you speak to us about what kind of assistance is expected and exactly how it'll assist with the situation that is happening at the moment?
Very early, we had a tweet, maybe it was seen elsewhere, including South Africa, was by the Serum Institute of India's Mr. Poonawalla, who said the kind of raw material that is available in the United States of America is what he would require to ramp up the production. Subsequently, there are issues. For instance, the AstraZeneca, which was obviously does not work in South African strain, as we all heard, is something which the United States is also not using. They have a huge stock of AstraZeneca, which in India is part of the inoculation process. In fact, many people have taken Covishield, including, as I speak, I have had my first dose of Covishield. So they are saying, if you're not using it, why didn't you release it? So these are, I think, the Biden administration has not really responded as of now, but we just read a tweet, I read a tweet from the White House spokesperson saying that they are in constant touch with Indian authorities and try and do what they need to do. So the contours are not yet clear, but India certainly is looking for assistance so that it can ramp up the inoculation processes. Because that's where we are. I mean, if America has enough doses for its own population.
Prasad, thank you so much for just that update on the COVID-19 situation in India.